Good afternoon, everyone. This is Beth DeHart. I'm the Director of Long-Term Care with Essie Thrive. We are so happy to be bringing you another installment of Real People, Real Conversations. This time, our focus is on seniors. It is May, which is Older Americans Month. So we really wanted to celebrate everything that we have going on for seniors and to talk through some challenges that some of us may face as our families age or even ourselves as we age. So I'm really excited to welcome Connie Munn with me today. She's going to be answering some very important questions. And Connie, first, if you wouldn't mind, just introduce yourself and what you do.
Hi. Okay, great. Thank you, Beth. And it's so great to be with you this afternoon and talk a little bit about what our agency does. And I'm Connie Munn. I am the director of the South Carolina Department on Aging. And our agency is responsible for enhancing the quality of life for our older South Carolinians. We know that we have about 1 million older individuals living in South Carolina, so we want to make sure that we have enough resources and information for them to be able to age in place and also to serve our most frail elderly. We work with a network of regional and local organizations that help develop and manage these services, that also help our seniors remain independent in their homes for as long as possible and living in their communities. And a lot of those, Beth, I know you've heard of the senior centers. We have meal sites that can be found through the South Carolina Department on Aging. We work with a variety of area agencies on aging to do that are designed to help our seniors remain independent for as long as possible, and also promoting health and wellness. Some of the meals, the services we provide are home delivered meals, transportation, in-home care services. All of these are designed to keep our seniors living at home as long as possible independently, with a little bit of extra help when they need it.
That sounds really important, Connie. Can you talk a little bit about how some of these services get paid for?
The services get paid for through our agency. We have federal funding that comes down from the Older Americans Act, which is designated to provide funding sources. And we also have a state funds as well for home and community-based services, which are going into the homes, providing meals, in-home care services. And then also we have various grants that we have gone after before to help provide services. But this past year in COVID, we've seen a variety and array of additional funds that have come in to our state, and that's how we receive the funding.
I bet the need really has been amplified during the pandemic.
Most definitely has. Where we knew that there was social isolation was an issue before COVID, that just kind of has magnified that. And so again, trying to do the resources that we can to keep individuals socially active. We've had to do a lot during the past year with Zoom to keep them active and connected. So we're very proud of our seniors. They've been able to do a lot more than what we thought. I mean, they're tech savvy. We know that now.
Maybe with a little help from the grandchildren.
That's right. That's right.
So, Connie, we do know that there are special concerns that people need to consider when they are getting older. Would you say there are some common problems that South Carolinians face? And are there some key considerations that families and individuals should think about as family members age?
Yeah, one thing we do know, Beth, is as we get older, we lose our ability to do some things that we did when we were younger. And that's just a fact of aging.
Sure.
And so we want to make sure that our seniors, we're prepared to be able to face mobility issues. And again, that's family members can do simple things like going into their loved one's home, see if there's a rug that maybe be tripping up, their loved one, or lighting that needs to be placed in the hallway or at the back door to keep an elderly person from falling. We do know that if someone falls, we know the research has proven that, if that happens, it could be catastrophic for an older individual who may end up in a nursing home and not be able to return home because they're at risk of falling. And so those are some areas particularly that loved ones can do to kind of help their older individual living at home. We have 10 area agencies on aging that are available for resources as well for our seniors, their families, caregivers who care for loved ones with dementia. And so there are a variety of resources in the communities, and that's what we can help connect with the area agencies on aging, because there are several, we work with the faith-based organizations. There are a lot of churches, there are various groups that would come in and be able to do simple home modifications. Allows the senior to move around their house more freely and feel more confident. And also, just to highlight a couple of resources that we have at our agency, one is a partnership that we did with the South Carolina Bar Public Services Division, and we developed, it's called the South Carolina Senior Citizens Handbook, a guide to laws and programs affecting senior citizens. And this helps to make the seniors and family members to make informed decisions. That is available and certainly up on our website. If anyone would like that information, we can get that to you. Another resource is our web resource. It's called GetCareSC.com. And so I know you are familiar with that as well. We're very proud of it. It's aging is a very complicated issue, as we know. People don't know exactly where to find the resources. And so GetCareSC is that resource that allows seniors, caregivers, loved ones, even other agencies to come and look and put your zip code in, and it'll pop up and show you what types of services are available in that area. We have a bed locator if you are looking for a nursing home. We have a bed locator that's on there that you can go research and kind of play around and see what all is available for services there.
I wanted to offer just my experience with your website. It is an invaluable resource for people who are working with seniors or have senior family members, or just are interested in what's going on with seniors and what's available. GetCareSC is a serious resource for any of these kinds of questions. I just wanted to, give you guys a thumbs up, because that resource is really, really good. And then I heard you say that you all have, you support or partner with local area agencies on aging, and also churches, and then nonprofits like the South Carolina Bar. And here we are, Essie Thrive, you partner with us as well. So I just love that you have so many tentacles in. You're really trying to reach into the community wherever seniors are and meet them there. And that's really powerful. I did want to ask you one follow-up question, though, just for clarity, because the local area agencies on aging really do have, they have tremendous resources, human resources and otherwise there as well. But it's not that every single county has its own area agency on aging, right? Sometimes they're sort of in groups. Is that true?
Yes, you're right, Beth. There are 10 area agencies on aging across the state. And so those are the agencies that we contract with. We work directly with them, and some of them have 3 counties, some have 4, some have 6. But and 7 are located within a council of governments, and 3 are freestanding area agencies on aging. And each one of those are responsible for planning, coordinating, having an array of services available. They're tasked through the Older Americans Act and through our agency to make sure that there are services available for the most frail older population, so that they can age in place. And so, yes, you're right. And from that, they contract with various organizations. Many of the councils on aging that hold contracts with the area agencies on aging, which is how we then go down to the third tier, if you will, with services, and how we make sure there are boots on the ground, the councils on aging, to get services out to the seniors.
So that sounds like potentially each area agency on aging might offer services that are a little bit different. Is that right?
Exactly. Many of them, you have your basic services, which we call, the meals, transportation, home care services, evidence-based services, but then also a variety of resources. Many work with intergenerational, and we feel like, with our seniors, like we were saying, tech savvy, having your grandchildren to help with that. We have found that working with the school districts, some do, to have intergenerational programs available, so that the seniors can be in the schools and work with different classes and students, and that's been very helpful. But yes, they're very innovative, and all of them offer different. And there's the basics. So a lot of times sometimes you may move from another state, or you move within South Carolina and think, because this was provided at one area agency, that you have it in another one. So that's not necessarily the case, because there are a lot of innovative programs that are going on in South Carolina.
Makes total sense. Thank you so much for that explanation. So, Connie, are there some things that families can do to head off maybe some problems that family members might face as they age? I know you said already maybe going in and helping with some home modifications, but are there other things that families can do to make that transition to older a little easier?
I think the main thing is just it has with anything, anything in life that we do, planning and being prepared goes a very long way, particularly with aging. There are things we can do that, we don't like to discuss at any age, but having a living will, having an advance directive, healthcare power of attorney, all of these things that when you're, if you're faced with a catastrophic issue or, your loved one is in a nursing home or in the hospital, having these types of policies in place helps. So planning for that. Also, just talking about issues sometimes, and as we were talking about on GetCareSC, there's a certain, if you go in and search it, it's called How to Start a Conversation, and that is an article that helps family members when they're not sure how to start this conversation with wanting to have, a living will or an advance directive. Those are some resources that are certainly available. And we just encourage, family members, nutrition, health. We know staying physically fit, physically active is key to better health, and fall prevention. One of the programs that we fund is called the Evidence-Based Series.
So staying physically fit is important, and I think you were mentioning that yoga is a good option maybe for seniors.
Absolutely. The other piece to it is also, just being connected with your friends. Again, I go back to COVID and what it did to our seniors when they were socially isolated. It's just being around others. That's so important for our seniors to stay connected socially. It's very important. The meals is how they stay connected as well. It's truly not just about a meal in a congregate site. It's that socialization and seeing their friends and sitting around a table and fellowshipping with them.
Yeah, that's true for all of us. That part is an essential part of a good quality of life.
Mm-hmm. Absolutely, yes.
Yeah. Golly, those are some really, really good tips, Connie. Thank you so much. I know that the South Carolina Department on Aging has a lot of resources for individuals and families, and you've already told us about GetCareSC, and you've told us about your connections with the community. Are there any other resources that the Department on Aging offers?
Well, actually, we do. We have one of the resources that we have is the ombudsman program, and that is, they work mainly with our ombudsman goes and they advocate for individuals in long-term care facilities, and so that's been a huge asset to I think the community as well, because these ombudsmen, they're trained, they're certified, they go through months of training to make sure that they are, they know exactly how to go in and advocate for the residents in the long-term care facilities. We have a program where we do Medicare counseling, and that's through an open enrollment. And so that is another program that's essential to family members, anyone that we offer that assistance all year round, but particularly during open enrollment period, that's a key service that we provide. We have a program called the Vulnerable Adult Guardian Ad Litem program, and this is where it's a volunteer opportunity for individuals, and you can go on our website and sign up to be a volunteer. But we do that program as well as, and any way to get in touch with any of the programs that we offer is you can go on to aging.sc.gov or the getcaresc.com. We have a toll-free number, and I can give it to you, and then we can maybe post it. It's 1-800-868-9095. And we have a staff person, Miss Valeria, who is phenomenal, who will answer the phone for us, and she will talk with anyone and get you to the resources you need to be at. So that's a wonderful resource that we have as well.
So I wanted to ask you a question, Connie, about something you mentioned a second ago. You told us about the ombudsman program. Mm-hmm. That's a term that maybe some people have heard, but it's an unusual word. It's an unusual term. Can you tell us a little bit about what an ombudsman is and what they do?
The ombudsman, for us, and for as far as the Department on Aging is concerned, is these are individuals that go into the nursing homes or residential care facilities and will advocate for the resident. A lot of times it involves doing training for staff in the long-term care facilities. We work with family members to develop family member councils that will meet, coordinating councils, so that it's a support group for family members to discuss. But the bottom line is we advocate for that resident. And if there are any complaints on abuse, neglect, or exploitation that comes through our office, and we either handle it from our office or we work with the area agencies on aging, because each one of our area agencies on aging, those 10 that we mentioned earlier, they all have regional ombudsman at their office, and they handle the nursing homes in their regions.
So Connie, would this be an example of when an ombudsman would come into play? Maybe if a person is in a nursing facility and they don't have a family, maybe they don't live close by, or they just don't have family member, then an ombudsman would be able to come in and assist them with any problems that they might be having, something like that?
Yes, a lot of times, and we have a volunteer program again where the regional offices sign up individuals. Just basically, it's called a friendly visitor program to go into the nursing homes. Many times, they're the older individuals, residents don't have a family member, that checks on them, and so that's what this individual does. This goes into the nursing homes to check on residents. But yes, if a resident and feels like they need to talk with someone, if they have concerns of their care, they call the ombudsman. And those numbers are posted in all nursing. We work very well with the nursing homes. They have the regional ombudsman as well as our numbers that are posted, and can assist and make sure the resident gets in touch with someone that can help them.
Connie, you have mentioned a couple of examples as we've been talking so far that resonate perfectly with my own experience with my own mom. And I just wanted to reiterate how important some of the services that you have mentioned already became to me when my mother was getting older and getting less healthy. You mentioned a fall and how catastrophic that can be to an older person. That's exactly what happened to my mother. It was a simple fall, but for her, it was catastrophic because of her age and her fragility at that time. Went into a rehab facility. We had social workers there that were able to help us get applied for the Medicaid long-term care benefit that helped cover her expenses. They helped transition into a nursing facility. And as you said earlier, you worked really well with the nursing facility, and the nursing staff where my mother was were invaluable to me and my family. At that time, I didn't know a lot about long-term care and the needs of older Americans. I was just living it with my own mom, So I just wanted to emphasize that from my own experience, so many things that you have already mentioned were turning points for me. I would have been lost. I really would have been lost in trying to advocate for my own mother had I not had those good social workers, good policies in place, good transition plans from one service provider to the next. I mean, it was a hard time for us, as this is always going to be probably for families, but for me, it made it a whole lot easier than it would have been otherwise. So thank you again for all the work that you're doing.
Yeah, and I think just to tap in, one that we haven't really talked about is the family caregiver programs that we have with individuals with dementia. That's a key service that we do offer, and with the respite vouchers that are provided, and that again comes from the regional offices, and that is helping individuals with loved ones who care. And we know the caregivers give care 24/7, around the clock. And so to be able to provide some type of respite, we do know if caregivers don't take care of themselves, they're not able to take care of their loved ones. And so that's another program that it's invaluable, that a lot of people don't know is available to them out there. And so again, want to just kind of highlight that program. And what you talked about, you're right, with the social workers, so many times it's a team approach. You've got to have everybody on board and know what's going on with your loved one, because there are all types of physical problems that are taking place. And if you're all on the same page, it's much better to know what's the best course of action to make sure that your loved one is being taken care of.
Mm-hmm. And there was another thing that you said just a few minutes ago that I did want to highlight as a really important point, and that is the planning. And certainly nobody wants to think about, planning for your loved one's aging and things that come along with that. But it's a very, very important step in that it can help you get access to benefits and resources that you will need to help support them, to help them stay home as long as possible, to get them support if they are at home with caregivers coming in or meals coming in and transportation assistance. I mean, we've got families we know right now where mom or dad lives in one city and all of their adult children live in whole different states. And so those kinds of resources are critical. And in order to get access to those resources, much of the time what you need is documentation and paperwork. You need um, advanced directives. Like you said, you need access to proofs of income and proofs of resources and copies of insurance policies and things like that. So, I mean, if you want, that move into older adulthood to be as seamless and easy as possible, it's a really important conversation to have with your older family members to say, just give me a copy or tell me where they are. Tell me where the life insurance policy is. Tell me where the long-term care insurance policy is. Tell me where your advanced directives are. So, or let's go put them in a safety deposit box or something like that, just so that you know where they are. The last thing you want is to have some of this stuff done ahead of time, and then you can't put your hands on it when you actually need it.
Yes, that's an excellent point. And I know but like I said, personally from my end, with at 1.3 aging parents, and father and mother-in-law, I had folders on each one of them with powers of attorney, and at one point all three were in these same nursing homes. So yes, it's very important to have all your documentation together. It makes decisions easier at times as well. Just like I said, to be organized and have that. It's not what we want to think about, but it certainly helps when situations come up that need a quick answer.
Right. And, when something happens, if a family member has a stroke, for instance, you're already feeling scared and worried and stressed and emotional and all of that. And, it just, the last thing that you want on top of all those feelings is a sense of inability or not knowing how to find paperwork, right? So if you've just got that kind of thing done and ahead of time, it sort of gives you, permission to just feel what you're feeling and try to be there as much as you can for your loved one without having to have that added stress of rifling through file cabinets or closets or shoeboxes to try to find documentation that you might need. So, Connie, we know, as we mentioned earlier, that May is Older Americans Month nationally in America. And we know that older adults have built resilience and strength over their lives through the successes they've achieved, failures they've gone through, joys, difficulties, all of that. And in May, we celebrate the strength of older adults with special emphasis on the power of connection and engagement in building strong communities. So you've mentioned this already a little bit, like the importance of using your local resources to be there to support our older Americans and our older South Carolinians. But can you offer any thoughts on how seniors remaining connected and engaged helps to sustain them long term and to also contribute to their communities?
Yes. And Older Americans Month is in May, and so it's really a great opportunity that we have done in the past to say thank you to our seniors for all that they contribute to South Carolina and the contributions they make. And sadly, the last 2 years we've not been able to recognize them. We usually have a big celebration, and hundreds of seniors come to Columbia and we're able to celebrate them. So we have not been able to do that. But this year, Governor McMaster did sign a proclamation for us, and it is honoring Older Americans Month and older adults in South Carolina, encouraging all South Carolinians to recognize older adults in the part that they play in our communities. And so I just want to, take a minute to also ask, if you're viewing this, to reach out. Even if May passes and you see this, please, thank older adults for what they contribute to our community. We know that they play a vital role in so much, as many times, Beth, you and I, if you just sit down and talk to an older individual, they are a walking encyclopedia. And most people don't even know what encyclopedia is anymore, but, some have lived 80, 90, 100 years, and just the stories they can tell us in our younger generation on what they had to do to survive. It's just key. So spend time to talk with individuals and listen to what they have to share, because they have so many wonderful stories to share, and they are a huge part of our of our communities. And I think the important piece, takeaway is to just remember that our seniors are, we don't need to put them aside. They need to be honored as the individuals that they are and the life that they've lived and all that they've done for us.
For sure. I mean, the truth of the matter is a lot of the conveniences and quality of life elements that we celebrate today are because of them. They were our teachers, and they were the researchers, and they were the developers and the engineers and the infrastructure builder. They did all that so that we can have, so much that we enjoy today. So I love that point, Connie, just to, if nothing else, just talk to them and hear their stories. One thing that I do in my job, Connie was able to help me with this in the beginning, was we assist older seniors to apply for the Medicaid long-term care benefit, which helps to pay for community long-term care, which is nursing home type care in the home, and also nursing home services themselves. And Connie, to your point that you made earlier, I was able, I think it was in March, I was able to assist a family to apply for the Medicaid long-term benefit for a gentleman who was 105.
Wow.
Yeah.
That is incredible. Yes.
It was amazing. It blew my mind just to think about everything that he had seen and experienced in his life. It was such an honor to work with them.
Mm-hmm.
So just to mention to everybody who may be watching that SC Thrive also offers a couple of benefits to seniors. First is the long-term care benefit. We have a web-based portal called Thrive Hub, where we have the long-term care benefit built in, the application built in, and we can help you apply. We can do it over the phone through our call center, or I can do it with you if you want to call me. Or, as Connie mentioned earlier a couple times, we have a partnership with our local area agencies on aging across the state, and there are people there who are trained to take the long-term care Medicaid application with families. So that is a really beneficial benefit that we like to offer through SC Thrive. We also have a Prime advocate, and we have a senior SNAP advocate who can come out to, if you have a church or a community group of some sort that would just like to learn more about Prime, which is a benefit for seniors, as well as senior SNAP. SNAP, we know, is the Supplemental Nutritional Assistance Program, and the senior part just gets them expedited benefits if they are eligible. So those are three benefits that we at SC Thrive can offer primarily for seniors, and we're really proud to be able to offer all three of those. So, and thanks to Connie, because again, she helped us bring a few of those on deck in the beginning. So she's been a cheerleader for SC Thrive for a while now. We're grateful. Yes. Connie, is there anything else that you'd like to share or emphasize before we close out today?
I just wanted to say thank you, Beth, because really we have been, you opened my eyes a while back on just stepping outside of the box. We get sometimes in our rut and we think, oh, we can't do this, but the sky's the limit, and we realize, funding is not always going to be there at the level we need. We know our older population is growing by leaps and bounds, growing really more rapidly than our younger generation is, and our children. And so we need to be able to have these partnerships that we have developed, because we can do so much more partnerships and working together to make South Carolina a better place for our seniors to live and age in place, and to be recognized and honored for all that they do. And so I really appreciate the opportunity to work again with SC Thrive. You're an amazing agency, and so we're pleased to be partners with you.
You're kind to say that, Connie. Thank you. We just all want the best for everybody, right?
That's right. You too.
Connie, thank you so much for your time today. It really means a lot to me, and thank you so much for everything that you were doing for the seniors that we're all trying to serve.
Thank you, Beth. I appreciate it. You have a wonderful afternoon.
You too.